Which immunoglobulin class is the first to appear in the primary immune response and is pentameric in serum? IgM. The J chain is required for polymerization of which two immunoglobulin classes? IgM and IgA. CD3 is a pan-marker for which lineage of lymphocytes? T cells. Complement component C3 convertase of the classical pathway is composed of which fragments? C4b2a. Name the acute phase protein that opsonizes pneumococci and activates complement via C1q. C-reactive protein. Interleukin principally responsible for class switch recombination to IgE? IL-4. Major histocompatibility complex class 1 molecules present peptides of what length in amino acids? 8 to 10 amino acids. The invariant chain IICD74 is associated with which class of MHC molecules during assembly? MHC class 2. Positive selection of T lymphocytes occurs in which part of the thymus? Cortex. Bruton tyrosine kinase (BTK) mutation causes which primary immunodeficiency? X-linked agammaglobulinemia. Severe combined immunodeficiency characterized by adenosine deaminase deficiency shows accumulation of which toxic nucleotide? Deoxyadenosine. Chediak-Higashi syndrome phagocyte dysfunction is due to defect in which cellular process? Phagolysosome fusion, lysed gene. High zone tolerance refers to tolerance produced by administering doses of antigen, very high. Name the adjuvant used in DPT vaccine that enhances Th2 response by depot effect. Aluminium hydroxide, alum. Passive immunity following snakebite is an example of acquired immunity, artificial passive. BCG vaccine confers protection chiefly by stimulating which arm of immunity? Cell-mediated Th1 immunity. The tuberculin skin test is an example of which type of hypersensitivity reaction? Type 4, delayed type. Rhesus isoimmunization leading to hemolytic disease of newborn is which hypersensitivity type? Type 2, antibody-mediated cytotoxic. Arthus reaction is a local manifestation of which hypersensitivity type? Type 3, immune complex. Energy in T cells is induced if antigen recognition occurs in absence of which co-stimulatory signal? CD28-B7 interaction. Treg cells characteristically express the transcription factor, FOXP3. Humanized monoclonal antibody trastuzumab is of which Ig subclass? IgG1. Omalizumab binds to which region of IgE? Fc portion, C-epsilon-3 domain. Rituximab depletes B cells by targeting which surface antigen? CD20. Interferon gamma release assay, IGRA, detects latent TB by measuring IFN gamma from N-cells, memory T cells, sensitized. Toll-like receptor 4 recognizes which pathogen-associated molecular pattern? Lipopolysaccharide, LPS. NOD2 mutation predisposes to which inflammatory bowel disease due to impaired sensing of muramyl dipeptide? Crohn's disease. The hinge region providing flexibility is absent in which Ig class? IgM, in monomeric mu heavy chain. Affinity maturation of antibodies is a result of in germinal centers, somatic hypermutation and clonal selection. Cytokine storm in COVID-19 is driven predominantly by excessive release of which interleukin? IL-6. Name the complement regulatory protein absent in paroxysmal nocturnal hemoglobinuria. Decay accelerating factor, CD55 or CD59, both absent. Purified protein derivative, PPD, contains precipitated proteins of Mycobacterium obtained by which method? Trichloroacetic acid precipitation, Seibert method. Payer patches generate IgA-producing plasma cells under influence of which cytokine secreted by Th2 cells, transforming growth factor beta, TGF-beta. The membrane attack complex is formed by polymerization of complement components C5b, C6, C7, C8, C9. Classical complement pathway is activated when C1 binds to at least XP regions of IgG. 2. Serum sickness historically followed injection of antitoxin raised in horses and is mediated by immune complexes of which Ig class, IgG. Live attenuated varicella vaccine induces protection predominantly through SEN antibodies, IgG, and memory T cells. Kawasaki disease immune pathogenesis involves formation of anti-endothelial antibodies leading to which vascular complication? Coronary artery aneurysm. Mast cell degranulation in anaphylaxis is triggered when antigen cross-links at least molecules of IgE, 2 adjacent. Cytokine IL-2 is secreted mainly by which subset of T helper cells? Th1 cells. Th17 cells produce IL-17, playing an important role in defense against which microbes? Extracellular bacteria and fungi, example, Candida. Natural killer cells recognize cells lacking which surface molecule? MHC class I. The secondary signal for B-cell activation delivered by CD40L is provided by which cell type? Activated helper T, Th cell. The C1 esterase inhibitor deficiency leads to which hereditary condition? Hereditary angioedema. Goodpasture syndrome autoantibody targets which type of collagen? Type 4 collagen alpha 3 chain. Immune privilege of cornea is partly due to expression of which complement inhibitory molecule? CD59. Original antigenic sin phenomenon refers to skewed memory response following infection with closely related X viral strains, e.g. influenza. IL-12 receptor deficiency leads to disseminated infections with which pathogen after BCG vaccination? Mycobacteria, including BCG. Type 1 interferons are chiefly produced by which innate immune cell sensing viral RNA? Plasmacytoid dendritic cells. Activation-induced cytidine deaminase (AID) enzyme is essential for which two B-cell processes? Class switch recombination and somatic hypermutation. Monoclonal antibody eculizumab targets terminal complement protein X, C5. NEET-PG oligodeoxynucleotides act as vaccine adjuvants by stimulating which TLR? TLR9. Graft versus host disease occurs classically after which type of transplantation? Allogeneic hematopoietic stem cell transplant. Hyperacute graft rejection is mediated by preformed antibodies, IgG and IgM against donor antigens. Delayed type hypersensitivity to lepramin is positive in which pole of leprosy? Tuberculoid pole. FOXN1 deficiency causes a thymic nude mice, showing absence of which lymphocytes? T lymphocytes. Two-signal model of lymphocyte activation was proposed by which immunologists? Brecher and Cohn, 1968. The prozone phenomenon in VDRL test results from antibody concentration. Excessively high. Hay fever is mediated by release of histamine from mast cells via binding of allergen to the receptor, high-affinity IgE receptor, Fc epsilon Ri. BCG revaccination is not recommended because cell-mediated immunity is measured by PROS test. Tuberculin skin test, PPD. Late complement components deficiency C5 to C9 predisposes to recurrent infections with which genus? Neisseria. IL-1 and TNF-alpha cause fever by inducing prostaglandin E2 synthesis in which part of brain? Hypothalamic preoptic area. The hapten carrier concept was demonstrated by Landsteiner using which chemical hapten? Dinitrophenol, DNP. ACG vaccine strain used in India is Danish 1331 strain. Thymus-independent antigen type 2, TI2, is typically composed of repetitive ULB structures, polysaccharide. Which immunoglobulin subclass is deficient in selective subclass deficiency, leading to recurrent sinopulmonary infections in children? IgG2. Hyper-IgE job syndrome is due to STAT3 mutation causing impaired differentiation of which T helper subset? Th17. The tuberculin conversion, PPD equals 10 mm, indicates development of which type of immunity? Cell-mediated delayed type hypersensitivity. Speak. Preformed mediator causing bronchoconstriction release during type 1 hypersensitivity besides histamine. Break time 400 millisecond. Tryptase or leukotrienes, LTs, are newly formed. Acceptable tryptase. Prosody. Clonal selection theory was proposed by which Nobel laureate? Frank McFarlane Burnett. Secretory component attached to dimeric IgA is derived from which cell? Epithelial cell, poly-Ig receptor. Which complement fragment is the most potent anaphylacticin? C5a. Listeria monocytogenes escapes phagosome using pore-forming toxin, unquote. Listeria lysin O illustrates cell-mediated immunity importance. The bacterial polysaccharide V antigen of Salmonella typhi primarily evades immunity by resisting what? Opsonization and complement-mediated killing. IL-10 exerts immunosuppressive effect by inhibiting production of which cytokine from macrophages? IL-12. Which pattern recognition receptor in cytosol recognizes viral double-stranded RNA? RIG-I-like receptors, RLRs. Haptoglobin is an acute phase protein that binds to free, in blood, hemoglobin. Major basic protein is cytotoxic component of granules from which leukocyte? Eosinophil. Self-limiting immune response termination, partly by expression of inhibitory receptor PD-1 on cells. Activated T cells. Checkpoint inhibitor nivolumab is a monoclonal antibody against programmed cell death 1, PD-1, receptor. Opsonization of Staphylococcus aureus for phagocytosis is chiefly mediated by which Ig subclass? IgG1. The Hib conjugate vaccine uses a carrier protein derived from which bacterium? Corynebacterium diphtheriae, CRM197 mutant protein. Fractional inactivated polio vaccine, FIPV, is administered at what age in India's UIP? 6 and 14 weeks, 0.1 ml intradermal. Name the only immunoglobulin class capable of crossing placental barrier, IgG. Heat label toxin of ETEC activates adenylate cyclase by ADP ribosylation of which G protein subunit? GS-alpha, although microbial, emphasizes humoral response. Coccidioidomycosis elicits delayed type hypersensitivity detectable by which skin test antigen? Spirulin, coccidioidin. Most antigenic component of influenza virus targeted by neutralizing antibodies is hemagglutinin, HA, glycoprotein. Beta-2 microglobulin is an essential, non-polymorphic component of which MHC class? MHC class 1. Tetanus toxoid is an example of vaccine, inactivated toxoid. Mannose binding lectin activates complement via which pathway? Lectin pathway. XLA patients are particularly vulnerable to infections by organisms with which capsule component? Polysaccharide capsules of encapsulated bacteria, e.g., Streptococcus pneumoniae. CD16 Fc gamma R3 on NK cells mediates antibody-dependent cellular cytotoxicity by recognizing region of IgG. Fc. Bystander activation of T cells without specific antigen is also called activation. Polyclonal. Eosinophil activation in helminth infections is driven mainly by which Th2 cytokine? IL-5. Live attenuated Japanese encephalitis SA14-14-2 vaccine confers protective neutralizing antibodies of which Ig subclass? IgG1, long-term. Pre-erythrocytic malaria vaccine RTS-S induces antibodies against which plasmodium antigen? Circumsporozoite protein. Hyperacute organ rejection can be prevented by pre-transplant cross-match test, complement-dependent cytotoxicity, CDC, or flow cross-match. CH50 assay measures functional integrity of which complement pathway? Classical pathway. Polio-specific secretory IgA in gut is better induced by which vaccine formulation? Oral poliovirus vaccine OPV. The ratio of kappa to lambda light chains in serum is normally approximately 2:1.